Visual diagnosis, let's talk about the red tongue. The presence of heat can turn the tongue red. This is because the yang nature of heat drives blood upwards to the surface of the body. In Western medicine physiology, the body opens and increases the flow of blood in the exterior aspects of the body when the temperature rises, enabling blood to dissipate some of the heat to the surroundings. This means that the tongue will be more red in color. The opposite is the case when the body is too cold, with yang deficiency cold and yin excess cold in Chinese medicine. In these situations, the tongue will be pale in color due to the reduced amount of blood in the superficial blood vessels. The whole of the tongue may be red, or it may only be specific areas of the tongue that are red. If an isolated area of the tongue is redder than its surroundings, it will indicate the presence of heat in the organ that manifests in this area of the tongue. The presence or lack of coating is diagnostically very important when diagnosing a red tongue. The presence or lack of coating will indicate whether to diagnose excess heat or yin deficiency heat. In excess heat, there will be a yellowish coating, whilst there will be a lack of coating on the tongue when there is yin deficiency heat. When there is heat present, the tongue will usually be dry. There is, however, a situation where the tongue can be red and wet. This can occur if there's an acute condition of extreme heat. In this case, the extreme heat derives fluids in the body upwards and outwards. This will make the tongue temporarily wet. The person will probably also sweat profusely in this situation for the same reason. Another scenario that can manifest with a red and wet tongue is a condition of damp heat. Here, there is the presence of a yin and a yang pathogen simultaneously. It is important to remember that yin deficiency can exist without resulting in heat, in which case there will be a normal colored tongue that is dry and lack in coating. By red is meant too red. A red tongue body always indicates heat. If the tongue has a coating, it indicates full heat. If there's no coating, it indicates empty heat. This is the picture of a red tongue body color. It's very red. So again, for a normal tongue, you will see it will be pale because there's sufficient fluids from stomach reaching the tongue, and red because of the supply of blood from the heart. When it is pale and slightly dry, there's blood deficiency. When it is wet, that's yang deficiency. Bright and shiny, qi and blood deficiency, particularly of spleen and stomach. When the tongue is red with coat, there's heat in nutritive or blood levels. Without coat, yin deficiency with heat. When it's wet, heat with damp retention. Dry is deficient heat and body fluid exhaustion. Shiny is stomach kidney yin deficiency. Red points or spots, heat with blood stasis. Prickles is heat and yin level or upper jiao or lower jiao. Purple spots in the center, blood stasis and heat in stomach. And it is peeled, there's heat from stomach and kidney yin deficiency. When it's purple, there's heat and blood stasis. Purple distended is extreme heat with blood stasis and toxin from alcohol injuring the heart. When the tongue is deep red, when it is scarlet red, there's lung or heart yin deficiency. When it's dark red with a dry center, there's stomach fire blazing or stomach yin deficiency with heat. A red tip, usually on a red tongue, indicates heart fire or heart empty heat, according to whether the tongue has a coating or not. In severe cases, the tip can also be swollen and have red points on it. Red sides indicate liver fire or gallbladder heat if there is a coating, or empty heat in the liver if there is no coating. In severe cases, there may also be swollen and display red points. A red center indicates heat or empty heat of the stomach, depending on whether there is a coating or not. Red tongues are likely to have red points or spots. These are raised papillae and always indicate heat. If they are rather large, called spots rather than points, in addition to heat, they also indicate stasis of blood. Red points or spots are frequently seen on the tip, on the sides, on the root, and around the center for stomach and heat. Red tongue, so when it is red, there's heat. Red with coating is full heat. Red without coating is empty heat. Red tip is heart fire or empty heat. Former with coating, latter without. Red sides with coating, there's liver fire or gallbladder heat. Red sides without coating is liver yin deficiency with empty heat. Red center, heat or empty heat of the stomach, depending on whether there is a coating or not. Red points on the tip is heart fire. Red points on the sides is liver fire. Red spots on the root is heat in the lower burner. And red points in or around the corners is stomach heat. Thank you so much for your attention.